morning, everybody. So, my name is Danielle. I'm from South Africa. I'm from an organization called Stem Cell Africa. Okay. We have dedicated our time and energy and efforts into bringing awareness about autism, cerebral palsy, and basically new regenerative medicine, because a lot of the world does not know about it. And I have a brother with autism. He's now 38 years old, and we've made it our mission for people to be more aware of autism. So we have got in contact with Dr. Sharma, and we love the work that he does, and has changed so many children's lives, so many parents' lives. And we'd just like to thank you, Dr. Sharma, for coming to Mauritius and giving this talk.
Good morning, everybody. It's a real pleasure and a privilege to be in this wonderful, beautiful country and with all of you wonderful people. There's something very special about this land. There is something very special about the people here. Today, we are going to talk on what are the new recent advances in the treatment of autism, cerebral palsy, and other incurable neurological disorders. I just wanted to know from you, how many of you are parents of children with autism? Can you raise your hand? Okay, so that's a big chunk. How many of you have cerebral palsy children? Are there any parents of children with muscular dystrophy? Alright. Anybody with adult problems, spinal cord injury, brain stroke? So we have no adult patients here. Alright. So, once again, we come to you from India. Bonjour. How do you pronounce it? Bienvenue. That is welcome. I'm trying to say it in French or Creole. And namaste from India. I'd like to, today I understand is Mauritius Mother Day. So I wish to welcome and wish all the mothers here, and the fathers as well, of course, why not the mothers, but the mothers are very happy Mauritius Mother's Day. Over all these years that we have worked, we've realized that what parents of children with special needs go through, nobody really understands. Okay? Because for somebody who doesn't know what it is like to handle a special needs child, they can't understand the difficulty and challenge every day. Like every single day, just from waking up in the morning, getting your kids ready, feeding them, getting them to rehab, how challenging each day is. And especially kids with autism, they otherwise appear, they look normal. So the world doesn't really understand what you go through. That you put everything in your life on a back burner. There is nothing like a personal life because your whole life is about your children. Isn't that correct? And today I want to acknowledge all the sacrifices that you've made, all the hard work you've done, all the patience and perseverance you've had to bring up these special needs kids to where they are right now. And today is, I would consider, an auspicious occasion to wish all mothers. I am Dr. Alok Sharma. I am a neurosurgeon, and very early on in my career I realized that the nervous system could not heal through conventional medical and surgical treatments. Up to now, we had two kinds of treatments. Either you used drugs, medicines, or you did surgery. You cut, stitched, removed a tumor, fixed a spine. But once the nervous system was damaged, no medicine was working and no surgery was working. And I realized that the ultimate hope was cellular repair. You had to regenerate the damaged cells. And that set me on a career path that took me a long way. I trained in Sweden, I trained in America, I went to different places all over the world, did 10 years of basic fundamental research before we started work in 2008. And from 2008 till now, we have treated over 12,000 patients and children from over 70 different countries with a very new innovative treatment, which is not a drug, it is not a surgery, it is cellular therapy using stem cells. I am a director of the NeuroGen Brain and Spine Institute, which is dedicated for this work. And I'm also professor and head at the University Hospital Medical College. That is the LTMG hospital. So we are all here because we have special needs children, and you've gone from pillar to post. You have gone from doctor to doctor, therapist, rehabilitation centers, associations, to try to get help for your children. And you've been told only one thing, that nothing can be done. The only solution was rehabilitation, that there was no medical treatment. Isn't that what you've been told? Right. And I'm here to tell you that that is no longer true. That God has finally listened to our prayers, and today modern medical treatment, science, development, technology has come up with a solution that can help our special needs children and very often completely reverse the problems that they had. And I'm going to show you all that data over the presentation. So you all here because of your lovely children, and there was life before today and there's going to be life after today. If up to today you were in a dark tunnel and there was no light at the end of the tunnel, wasn't it like that for you? You were in a dark tunnel and there's no light, you're told nothing can be done. Today finally you're going to see light, and I'm going to show it to you not theoretically but in real patients, real data. So I'm going to focus on three types of treatments. One is cellular therapy using stem cells. The second is rehabilitation that you all are already aware of. And finally, a treatment group called integrative therapies, which are basically oxygen-based therapies that help in repair. So we're going to look at three types of treatments, and it is this combination that is going to help our children regain independent, functional lives. So here in this slide on the left hand side, you can see a bone that is fractured. And just a minute, there's no screen there, is it? Why don't you all come here? It'll be easier to see. Because you can't see from there. Why don't you come here? No, let them sit here because it's just a little easier. Can you see from there?
Yes.
Or you want to come this side? You can sit in front, there's a lot of empty seats here. No, I thought there were two screens. All of you can see? Yeah.
Yes.
All right. So, look at this. This is a fracture of the leg. And I ask you, if you had a fracture of the leg, would you do physiotherapy and exercises on this broken leg? Would any of you do that? What would you do? You would go to an orthopedic surgeon. He would fix it, right? With plates and screws and a plaster. And then we would do rehabilitation. But guess what? With our special needs children, we are doing exactly the opposite. This is a PET CT scan, a brain scan, where the blue is damaged part of the brain. This is of a child with autism. There should be no blue. Blue means hypometabolic non-function. I'll talk a little bit more about that in detail. We are giving rehabilitation on this damaged brain. This is a brain that's incapable of doing the things we are expecting our children to do. We are expecting them to talk, we are expecting them to control their behavioral issues, we are expecting them to have attention and concentration, which is not possible because of this damage. Alright? Now, what if we fix the damage? Here you can see that blue has become green again, and now gave rehabilitation. Would or would we not get better results? You tell me. Would you get better results on a damaged brain, or would you get better results on a repaired brain? And I'm here to tell you that it is possible to repair this brain. Like I said, we've treated 12,000, not one or two, 12,000 patients with this combination of our treatments. The older thinking, and this is a thinking over the last 150 years in the medical field, that once the nervous system is damaged, you can't do anything to fix it. Right? That's the old thinking. Unfortunately, 95% to 99% of the medical community still believes in this. But there is a new thinking. And the new thinking is that some amount of regeneration is possible through a process of cellular repair and replacement. So this is what is new, that the damage can be regenerated. So I said I'm going to speak about three parts: cell therapy, which is stem cells, rehabilitation, and integrative therapy. First, I will start on stem cells. So, like I said, stem cells have shifted us from a state of hopelessness to one of hope. When I was a medical student studying in the 80s and 90s, there was no hope when we looked at patients who had spinal cord injury, brain stroke, children with brain damage, cerebral palsy. There was nothing. But that has changed. In those years, there was no mobile phones. In those years, there was no internet. The world has changed, and so is the field of medicine changing soon. So now we don't have to be hopeless anymore, we have hope. What exactly are stem cells? So the word stem comes from the stem of a tree. And just like the stem of a tree gives rise to branches, leaves, fruits, etc., there are some cells which can give rise to all cells of the body. So a cell which can become any cell, it can become a brain cell, a muscle cell, a liver, a heart cell. That cell is called a stem cell. How do stem cells work? First, stem cells have the ability to multiply. So if you have a single stem cell, you can make thousands or hundreds of thousands or millions of stem cells from a single stem cell. The second ability is that they convert into other types. This is the most important property. If you take a single stem cell, you can make it into a brain cell, into a muscle cell, into a blood cell, into a heart cell. The same stem cell can become whatever you want depending on where you put it. So if I take a stem cell and put it in the brain, it becomes a brain cell. If I take a stem cell and put it in the heart, it becomes a heart cell. And then before I told you, they have the ability to multiply. So these are cells which multiply, but they also convert. And this is a picture, this is not from Google, this is my own original research. These are cells. Originally, the stem cell looks like this. And we showed in the laboratory that these stem cells, they actually convert into brain cells. You can see those. So these are brain cells. So we first showed that stem cells have the ability to convert into brain cells in the laboratory. And not only convert, but they connect. See, these are connected to each other. So this is what it looked like, and then we showed that these can convert. So having proven that first, we then went on to do our other work. Stem cells also have the ability to release certain positive chemicals. These are called growth factors. Medically, this is called the paracrine effect. Many of these growth factors have a positive healing effect on the brain and even the rest of the body. So when you put in stem cells, there's a flush in the body of positive healing chemicals and growth factors. They also improve the blood supply. So when stem cells, wherever they go, they actually attract more blood towards it. This is called angiogenesis. This is the way it is described. Now, stem cells are of different types. You can have, there are many medical classifications, but I will use a simple one for your understanding. You can either get stem cells from your own body or from the child's body. That is called autologous. You take from the body, put it back into your body. That is what we use. And you can have allogenic stem cells, where you take them from somebody else and put them in your child. So we prefer autologous, and I'll explain to you why subsequently. There is another classification of stem cells, and this is a little important to understand. First, actually, 1998, there was embryonic stem cells were discovered. The embryo is what happens, when the father's egg, a father's sperm and mother's egg comes together, it's called an embryo. And from that, the whole body is formed. So it's called, when fertilization occurs, on the 4th or 5th day of life, we are a bundle of grape-like cells. All of us. On the 4th or 5th day after we were conceived, we were a bundle of grape-like cells, and these are embryonic stem cells. So all of us, on the 4th or 5th day in a mother's womb, what were we? A bundle of stem cells. These stem cells are embryonic stem cells, and from these, your whole body was formed in 9 months in your mother's womb. Which means that these cells have the ability to become all parts of the body. Have you understood that? So we all got a bundle of embryonic stem cells. However, the use of these stem cells is controversial. There are many ethical issues. There are certain problems, there are certain side effects, so we do not use this because this is from some other embryo. This is from, either from a spare embryo of a test tube baby, or fetus, etc. So there are a lot of people who do not like its use, and we do not use this. The second type of stem cell you get from the umbilical cord. So the umbilical cord is the cord that connects the mother and baby at birth. You all know the umbilical cord. It's normally cut at the time of birth and it is thrown away. But this umbilical cord contains an amazing number of stem cells. And nowadays, instead of being thrown, this is being preserved. Has any of you preserved your child's umbilical cord? Unfortunately, you haven't. But nowadays, in India and many Western countries, they are preserving it. If you preserved it, then those cells could possibly be used for your child for certain other conditions. But what we use is we are using adult stem cells. So adult stem cells are cells, they are called adult, but they are in our body, and they are found in large numbers in the bone and in the fat. So inside our bone, you all are aware there is a liquid that is called bone marrow. You all must have heard of it, right? Bone marrow. What is bone marrow? Bone marrow is the place where our body's blood is produced. Have you ever wondered all the blood in your body, where does it come from? It comes from inside the bone. So the center of a bone is a factory for blood production. And over here, blood is continuously produced and it is sent outside to the rest of our body. To make fresh blood, the body needs stem cells. So it is stem cells which become blood. Because to make anything new, the body needs stem cells. So inside the bone, there are millions of stem cells. What are they doing there? They are all going to become blood. Okay? So, if you put in a needle and take out bone marrow, you will get some ready-made blood, half-made blood, and you get stem cells. These stem cells, if we put in the brain, they will become brain cells. If you put them in the heart, they become heart cells. If you put them in the liver, muscle, they become muscle cells. So we prefer this. So this is our preferred mode. Whatever I talk about will be autologous or adult stem cells. And the last one is something called induced pluripotent stem cell. This is in the research stage only, where the outside is adult and the inside is embryonic. But this is today not being used clinically. So why do we use adult stem cells? First, it is 100% safe. There is no risk whatsoever because these are your own child cells. They don't form tumors ever. They don't get rejected because they are your own cells. They are easily obtainable through a single needle prick and there are no ethical issues about its use. Now, that is where we got the stem cells from. How do you put the stem cells? The beauty of the stem cells is that you don't need any operation for that. You can put it through very simple ways. So the way we prefer is from the back side into the lower back. There is a fluid in the lower back called cerebrospinal fluid, which goes all the way up to the brain. So when we inject over here, it carries it all the way up to the brain. So this is our preferred mode. It's a simple injection. I'll show you a video of that as well soon. There are other ways of injecting. You can inject it via intravenous injection, intraarterial injection, intramuscular. You can put it through the nose. You can put it directly into the brain as well, although that is not very commonly done. So basically, in a single sentence, what is stem cell therapy? We are using healthy, good cells to replace damaged cells. We are using good cells to replace damaged cells. That's what we are doing. So if this is the blue color, this is a PET CT scan of a child with autism. The blue is the damage. If we give stem cells, the damage will go away. Now what's the scientific base for stem cell therapy? You're all aware, the highest recognition in the field of medicine is something called the Nobel Prize. Have you heard of the Nobel Prize? It's the highest recognition. And 3 times in 15 years, between 1990 and 2012, the Nobel Prize went to stem cell research. The Nobel Prize is given for all fields of medicine. And there is no single field of medicine that has got the Nobel Prize 3 times in a 15-year gap. So that explains the scientific rationale of the scientific base for stem cells, and what we are using, stem cells from the bone marrow, that got the Nobel Prize in 1990. Okay, that was, about 30 years, 40 years ago. What's the scientific basis of the work that we do? So, in the world of medicine, you have to understand, it is very important that the work you do, the work that any doctor does, is published in scientific, medical, peer-reviewed journals. Why is that important? See, I can come and present any data here. How do you know my data is authentic? Right. The only way to know your data is authentic is if it is published in scientific journals. This is a process called peer review. Peer review means doctors outside of me study my data, validate its authenticity, its scientific content, its ethical nature. And only if they verify all of that, then they publish it. And we don't have 1 or 2 papers, we have over 100 papers. And you can see 16 papers in autism, 15 in cerebral palsy, and many other conditions. Apart from medical journals, in the medical world we have textbooks. These are books that students and doctors read. And today, in medical textbooks, they have started introducing chapters on stem cell therapy. So in this book published by the SMG group, it's called Recent Advances in Autism, they've introduced a chapter, Stem Cell Therapy in Autism. And when they wanted to know who will write this chapter, they invited us. This is a chapter written by me. So whenever international authors want to write a book and they want chapters on stem cell therapy, they invite us. This is a book on cerebral palsy. This is a European book published by Intech. And again, they have a chapter, Stem Cell Therapy in Cerebral Palsy. And again, this has been written by us. They invited us to write. In this book on physical disabilities, therapeutic implications, the chapter Stem Cell Therapy in Pediatric Neurological Disabilities, again written by us. In this book on muscular dystrophy, published by Avid Science, Stem Cell Therapy in Muscular Dystrophy, again written by us. So I'm showing you all this to let you know that medical textbooks are today introducing chapters. I'm showing you all this to let you, because you'll be wondering, how come you haven't heard of this? If this is a treatment as good as it is, how come it is not known? So I want to tell you that this is all published data in scientific journals and medical textbooks. In India, we are very fortunate that at the highest level, there is support of stem cells. Our Honorable Prime Minister, Sri Narendra Modi ji, when he went to Japan, he actually took time off to visit the stem cell laboratory of Professor Yamanaka, who won the Nobel Prize for stem cells. Honorable Sri Narendra Modi ji, our Prime Minister, has written an introduction. This is in our regional language, and you can see that's my book. And he has written an introduction for my book. It's such an honor that we have Sri Narendra Modi ji, our Prime Minister, actually writing an introduction for a book. And this is myself presenting him a copy of that book. So he has been very encouraging of stem cells. And just to let you know how he feels about this, he gave a very impassioned speech in Parliament about stem cells. Let's listen into that.
तो जापान मेरे कार्यक्रम में मैंने एक कार्यक्रम क्या जोड़ा, मैं वहाँ एक नोबेल लॉरिएट साइंटिस्ट याकामा को मिलने गया। मैं इसलिए किया गया, उन्होंने स्टेम सेल के अंदर जो रिसर्च की है, मैंने जितना पढ़ा था तो मेरे मन में आया था शायद इनकी एक खोज हमारे काम आ सकती है। हम गए तो वहाँ गए, उनसे चर्चा की, और बेंगलोर के हमारे साइंस इंस्टीट्यूट के साथ आज उस दिशा में हमारा काम हो रहा है कि स्टेम सेल्स के द्वारा हमारे युवा साइंटिस्ट कुछ खोज करें।
Again, I mean, it's not often that Prime Ministers speak. This is in the Indian Parliament. Our Prime Minister is talking about stem cells in the Parliament. Okay, that's the kind of importance that he gives to this subject. So now, how is this treatment? And I told you it's a very simple treatment, but let's exactly see how it is done. So there are 3 steps to it. We take a needle, and I'll show you a video of this, and put it in the bone here. So our hip is below, there's the pelvic bone. You can all put your hand here, you can feel this bone here. Can you feel this? It's right below, you can, it's very easy to feel. So we put a needle in here, and we, once it enters the bone, we pull it with a syringe and we get bone marrow. This takes about 15 to 20 minutes. The child is given sedation, is sleeping, and we give local anesthesia, so there is no pain, the child does not undergo any pain. What we have collected, we take it to our laboratory where we filter it, separate it, and separate the stem cells from the other cells in the bone marrow. And once the bone marrow is ready, then with a very thin needle, we inject it into the fluid in the lower spine. So let's see the video how this is done. There you can see the bone marrow coming out here. Can you see this? That's the bone marrow. We take it to our laboratory. Here it is filtered. The cells are here. We are injecting with a very thin needle. This needle is thinner than the needle with which we collect blood. It's a very thin needle, and you can see those are the stem cells being injected. Let's quickly see it again. Alright. So you can see the bone marrow aspiration. Take it to the laboratory. Separate it. It's just separated. It's run through centrifuge machines. We just separate it, and then with a very thin needle it injects back. Just 2 needle pricks. There is no surgery. There is no cutting. There is no stitching. There is no intensive care. There are no lines or tubes or anything. With 1 needle we take out, okay, and with 1 needle we inject. That's all to the procedure. And what are we injecting? We are injecting cells taken from the child. There is nothing from the outside. There is nothing there which has chemicals or agents or anything like that. So, now briefly, since the majority of the parents here are children with autism, we will look at what autism is. So, we all know, I'll run through this fast, that it is a neurodevelopmental disorder. It was described, as compared to medical history fairly recently, 1943. Normally diagnosed in the first 3 years of life, and boys have it 4 times more than girls. We now refer to it as a spectrum disorder. In fact, slowly, even the word autism is going away. We are now talking of children as being neurotypical and neurodiverse. See, it is important to understand that just like, you can have a child who's tall and a child who's short. You can have a child who's fair, you can have a child who's dark. You can have a child with black hair or blonde hair or brown hair. They are diverse. They are different. If somebody is short, if a child is short and a child is tall, is there anything less in the child? The child is the same, right? Does the height, does the color of your skin, does the type of hair change you as a person? Likewise, the brains of our children with autism function differently. So now we call them neurodiverse. People like us are neurotypical, and children with autism are neurodiverse. And if there's one important message that I want to send to all of you, is that our children are not less than. They are different. Did you understand that? See, if a child has, let's say, an appendicitis or a stone or a chest tuberculosis or some infection, do we think our child is less than? Let's say a child, okay, the heart. The heart is a very important organ. Some children are born with a hole in the heart. Do you think your child is less than? No, you have a normal child. You think your child is normal with a medical issue. But when a child has autism, we feel there is a problem in the child. Okay? And that is what we have to change. Our child is like every other children. There's just a part of the child's brain that's working differently. Yes, they cannot do some things. They cannot have a normal education system. They cannot interact socially. They cannot communicate. And we need help for that, and I'm going to show you how we can help with that. But we have to stop seeing our children as less than. Unless we do that, they are not going to come out of where they are. We have to see that our children are different. You all agree on this? Can we make that resolution today? That we will see our children not less than, but different. Okay? So the main problems, now one of the main issues which the world is not recognizing is the massive increase in the incidence of autism in the last 15-20 years. In 2004, 1 in 166 children had autism. Right? In 2020, it was 1 in 54, and in 2022, it is 1 in 44. The CDC, the latest figures from America, show that 1 out of 44 children born today has autism. Something is wrong in the which we are living a life that there is so much autism. Something is fundamentally wrong in governments and people who make policies. People in the public arena don't seem to recognize the problem that autism is. it's not getting the same attention, it's not getting the same prioritization, it's not getting the same facilities and infrastructure. You know, we need more rehabilitation centers, we need more special facilities for these children, and that is not happening. So it's important that parents like you reach out, because governments, presidents and prime ministers listen to people, they listen to you. You have to work in a united voice and get their attention and say this is not a small problem. Okay, and this is a very important part of my work, that we need to reach out to people who make policies. So special policies are made. In our country, our Honorable Prime Minister has come up with a wonderful bill. It's called Rights of Persons with Disabilities Act 2017. It's an amazing bill which has so many rights and privileges for children with special needs. In fact, the Honorable Prime Minister went on to, earlier people with disabilities were called Viklang or disabled. And he said, let's never use this word. Let's use the word Divyang or specially gifted. In one statement, our Prime Minister changed the way we look at special needs children from being disabled to being specially gifted. Right? This comes right from the top. And this has to reach our presidents, our prime ministers, our health ministers, that we need to change things, because without support of society and government, it becomes difficult to look after our children. And this data must be available. There must be census. We must identify how many children have autism in Mauritius and in other places. So these are figures from the United States. This means that there are 70 million children today on the planet, children and adults. That's 1% of the world's population. You think, when you have a child that you're sort of alone. You're not alone. 1% of the population in the world has autism. The main problems, of course, as we know, are poor social interaction, problems with communication and repetitive behaviors. So what's new? Why am I here? I'm here to tell you two new and exciting and interesting facts. One, that today, as compared to 20 years ago, we have a much better understanding of what's happening in autism. We have specialized scans. We can look into the brains of these children. We can identify which parts of the brain are not working. And most importantly, we have a treatment that can address this. And that treatment is called stem cell therapy. So not only are we understanding things better, but we are actually coming up with positive solutions that can help and heal our children. So this is this is our research. And this is a brain scan. This is the front part of the brain called the frontal lobe. That's the upper part of the brain. So this is the intelligence area. This is the area of motor function. This is sensations, vision. And this is the area of speech, communication, attention, concentration. What is blue here is damaged. So we need to correct. Now, we have done this scan in more than 3,000 children with autism and little more than 2,000 children of cerebral palsy. And we found this kind of brain damage in all the children. We did a research project where we studied this in some normal children, and not a single normal child had this blue. So now, for the first time, we know which parts of the brain are not functioning in children with autism as well as cerebral palsy. And that is a beginning. Up to now, we didn't even know what the problem was. You were given a diagnosis and told take rehabilitation, but now you can see it. And even if you're not doctors, you can make a blue, right? On the scan, whatever is blue is not functioning properly, right? And this research of ours is published in a very prestigious journal called the World Journal of Nuclear Medicine, where for the very first time, we've actually shown exactly which parts of the brain are not functioning in children with autism. Now, the one important thing for all of you to understand is that the treatment of autism is going to be multidisciplinary. We keep looking for that one silver bullet. We want this one thing that will take our child away from autism. The good news is there are treatments. The not good news is there isn't a single silver bullet. It's going to be a multiple treatments. It's going to be a combination of rehab, which you already have in Mauritius. You have some very nice rehabilitation centers. We just visited some yesterday, and there's some very lovely places. But there's also stem cell therapy. There are also integrative therapies. There's a whole lot of other things, specialized treatments. Together, using all of this, we can get our children back to independent living. So I spoke about stem cells, and I'll come back to stem cells again. A little bit about rehabilitation. I'm going to run through this fast because you all know this, but I'm mentioning this to let you know the importance. The brain is like a computer, and a computer's got hardware, and a computer's got software. You agree? Stem cell only fixes the hardware. Stem cell cannot put software. The software comes from therapies, right? So unless you do therapies, you're not going to get the maximum benefit from stem cells. You have to understand this. That blue I showed you on the brain, that was defective hardware. If your laptop's hardware is defective, no matter what software you put, it will not take, right? But once you correct the hardware, you repair the hardware, you still have to put software after that. So this is very important to understand, right? So I'll go through this very fast. In rehabilitation, we have applied behavioral analysis, ABA. This is done by psychologists with special training and qualifications. The fundamental of this is that behavior has something which precedes it, and there is a consequence. And when you modulate what precedes in the consequence, you can modulate behavior. This is applied behavioral analysis being done at our institute. Then there is occupational therapy, which has different categories. In occupational therapy itself, there are many treatments, like activities of daily living, play, social, cognitive, behavioral, various vocational and recreational activities. So occupational therapy has a very important role to play, and this is occupational therapy happening at our institute. Sensory integration therapy, which is a part of occupational therapy, is again very, very important, and because many of our children have sensory issues, and sensory integrated therapy is important. This is our sensory integration room at our institute, and you need all of this. Then there's speech therapy. So a lot of our children have speech issues. So appropriate speech therapy program is very useful. This is speech therapy happening at our institute. Physiotherapy. Normally it was believed that physiotherapy is useful only in children with cerebral palsy. But physiotherapy is also required for children with autism, because they have certain problems with their tone, with their gait, with their posture and joints. So although most people believe that physiotherapy has no role, but we believe it has a role. So this is physiotherapy happening at our institute. Then aquatic therapy. Now we have realized over the years the importance of aquatic therapy. Now aquatic therapy is not swimming. People think aquatic therapy is swimming. No. Aquatic therapy is physiotherapy and occupational therapy in water. It's rehabilitation in water. It requires special skills. It requires specially trained people. There are special qualifications to do aquatic therapy. But the benefits of aquatic therapy are huge. I've listed all the benefits from sensory issues, social, speech, sleep patterns. We've noticed a particular improvement. It helps in hyperactivity, and these are all the list of benefits. So that is aquatic therapy, as is happening at our institute. Then there are art-based therapies. That's again art-based music therapy happening at our institute. So there are multiple therapies, and what is important is for all these therapies to be available, if possible, under one roof. The problem worldwide is that you have to go for occupational therapy somewhere, and go for speech therapy somewhere else, and go for psychology somewhere else. And the need, and this is important, and this parents can do. In many countries, we've seen that parents have come together and have created rehabilitation centers. Because only parents can understand the importance of this, right? That in one place, you should get everything. So you leave your child in the morning, and the child should have a session of occupational therapy, a session of psychology, a session of speech therapy, of education, so on and so forth. So apart from that, there are various other things. Many of our children have heavy metals and they need chelation and TRS detox. Many of our children have deficiencies of certain vitamins and minerals, like vitamin B6, vitamin C, vitamin D. We found various deficiencies of vitamins, so these can be supplemented. Diet has a very important role to play. There are certain foods that are encouraged, like probiotics, prebiotics, ketogenic diet, casein and gluten-free diet, camel milk, etc. And the foods to avoid are those with sugars, additives, pesticides, etc. A ketogenic diet which has enough protein but high fat and low carbohydrates is again very, very important in children with autism. But are we doing enough? Despite all rehab, our children are still not able to speak, not able to go to normal school, still have behavioral issues. That is where the role of stem cell therapy comes. So this is our data. We have shown a 89% success rate, or close to 90% success rate. So we have treated more than 3,000 children. This is data analyzed from about 700 patients. And you can see that 33% of the kids have a significant improvement. Significant improvement means they no more are on the autism spectrum. Their autism has been reversed. Alright. 29% have a moderate improvement. That means they are independent, but they are still not off the spectrum. 25% are still dependent, and 10% of the patients don't improve. Now, interestingly, we found an age correlation. We found that all these kids were below 11 years. In fact, more than age, they were before puberty. You know what is puberty? When a boy becomes a man, when he starts getting a mustache, drawing hair comes, sexual organs develop. In girls, menses starts. That's puberty. What our data shows is if you treat the children before puberty, you get the best results. Somehow when puberty comes, because in males, a hormone testosterone is released. In females, it's estrogen and progesterone. This changes the brain, and so the results become less. So mild and moderate is between 11 to 20. And almost all the kids who did not improve were over 20. Which means the earlier you treat, the better results you get. Even in this, we found that the children below 5 had the best results. So that is the reason, because very often, people say, doctors say, let's wait till it gets more established. If once there is a problem, you don't wait. If you have diabetes, you don't wait till you require insulin or a kidney transplant. If you have cancer, you don't wait till your cancer has spread. If you have a heart problem, you don't take medicine till you need a bypass. The earlier you treat, the more you can prevent something more severe from happening. So our own data shows that early intervention helps. Now I'm making a claim that stem cell therapy works for autism. What is the base of this? First, my data should be statistically significant, and I should have objective proof. Just saying that a child has started talking is different. I must have objective proof. So I'll show you both. Statistical significance is a medical thing. You may not understand it, but this is how we do. Like, this is a score, CGI score, Indian Scale of Autism score. We take an average of all the patients before, and then we take an average of all the patients after stem cell. And then by a mathematical calculation, we have to show it is statistically significant, that the difference is statistically significant. So we've shown that in our scores, even if you subdivide it into emotional response, social, speech, etc., all of this is statistically significant. But this is the most important part, and this, I would say, is the most important slide. I'm showing you one or two, but we have 3,000 such scans. 3,000. Before and after. On top, what you see is the blue. This is the same patient. You are seeing this from the top, from the front, and from the side. The blue is the damaged area, the inactive area, the non-functioning area. Medically, we call it hypometabolic. Normal children do not have this. Every child of autism in 3,000 children has this. This is before, and this is the cause of the autism. And now look below. 6 months later, you can see that the damage has almost completely gone. Right? This is objective proof that the damage in the brain of children with autism can be reversed. And we don't have one or two. Like I said, we have 3,000 scans before and after. Right? Again, here just to show you the damage before, and you can see that the damage is gone. Here to show you the damage before, you can see the blue, and you can see that the damage is gone. Now some people then asked us, well, because we do these scans at 6 months, this is an interval of 6 months. So some people question, how do you know after 2-3 years it doesn't come back? So in a few patients, we did this on a yearly basis. So here you can see you can see the damage before. After 1 year, it is much less. After 1 year, it is almost completely gone. So we have shown in several scans that the improvement is sustained and progressive. And once it improves, it doesn't come back again. Once the damage is healed, it doesn't come back again. So our work is published in a prestigious journal called Stem Cell International, and the world's first international PubMed index paper on stem cell therapy has been published from India. It's been published by us. You can see that's our paper. Autologous bone marrow cell therapy, an open label proof of concept study is published by us. So we are the world's first paper. The second paper came from China, the third from Italy, and the fourth and fifth paper have come from America. Now, if you're wondering why doctors in our countries, in Asia and Africa, don't know about this, are not aware of this, because we have, and I say it openly, I'm not, I don't get upset to say this, because I'm part of Asia and India, that in Asia and Africa, we have what I call a colonial hangover. I'm sorry I'm using that word, people don't like it, but I could say it. Because we were colonized earlier, we still look up to people from Western countries. When a doctor from America or Europe shows this, people believe it. But we don't believe our own people. We don't believe research that comes from India and Africa or from Asia and Africa. That is the problem. But here we are leaders. Okay, we are leading the West. Our papers have come out before them. America is following us. The Duke University, which has published these papers, I've actually had patients who've told me that when they go to Duke University, among the references they were given was our paper. So when people go to America, to the Duke University to enroll for the trial, among the data shown is our data. Let's see, it shows that stem cells works. So this is just to explain to you why. Because you must be wondering in your mind, how come my doctor hasn't told me about this? Isn't that question in your mind? If there is a treatment that can reverse my child's autism, how come my doctor hasn't told me? That's because our doctors, and I'm one of them, will look up to the West, but do not look up to the East in the same way. That is changing. The world is changing. The world is changing politically, economically, everything. Everything is shifting more from the West to the East, including medical developments. Apart from that paper, we have 16 other scientific papers on autism. And what I like, we have a few very short videos. I have children from five continents, a child from North America, a child from Europe, one from Asia, Africa, and Australia. Maybe I won't show you all of them, I'll show you 2 or 3. So the first one is this child from America. The father is a doctor, is a cardiologist, the mother is a nurse. And let us see the improvements this child had. Amazing improvements. A child who did not have speech, who was not going to a normal school. Okay? This child, you will see in the video, is not only going to a normal school but topping his class, getting A+ grades, and can speak in multiple languages. Let's see this very interesting story.
I couldn't get him to engage with me. I couldn't get him to make eye contact. Over time, he started to lose a lot of vocabulary. Right around 18 months to the age of 2 years, he just slid backwards.
He would flap like that, and he would walk on his tiptoes, look at the wall, and be talking to the wall. He had problems with eye contact. He'd never look you straight in the eye. He had problems with his speech. Some research and found out about NeuroGen. And the big question that I had in my own mind was, what is there to lose? And I could not come up with a good answer, and I said, we have to do it.
We started seeing better eye contact, definitely a difference in his engagement with us, with his siblings, his mood. He was so much calmer. Now he's all about taking his own shower. I have to just prompt him to get out, but he'll wash himself and he'll put his clothes on. It's all the PET scan images. I can't tell you, we were just so excited and thrilled. The areas that were hypoactive or non-active were new ones. There was activity there. Ganesh has gone from the 3rd grade, 4th month reading level to a 7th grade, 1st month reading level in 5 months.
3rd grade to 7th grade reading in 5 months. Look at this, A+ grades. So that is the power and magic of stem cells, right? Now, the next short video is one from Africa. Do you know how difficult and challenging it is to bring up one child with special needs? Here's the story of a mother who had triplets with autism. Imagine having to bring up 3 children. And before that, she had 3 daughters. So you have 3 daughters before, and then your 4th pregnancy, you have triplets. All 3 have very severe autism. Let's see their story. They're from Nairobi, Kenya.
Doctors, we went to different hospitals, and when I brought it up, they were like, oh, no, don't worry, it's because they're boys, they're triplets, they are premature. I'll be walking out and I'm like, bye. No child is crying, no child is waving back, bye. And by then, for sure, I knew that they should be doing that. Children had this behavior of disappearing. In fact, Eric disappeared 3 times in the middle of the night. The biting, the spitting, the scratching. How are we going to stop this behavior? We went to see the neurologist, and in 5 minutes, he said, this children are autistic.
As parents, it was very traumatizing. First of all, we didn't understand what autistic means.
So I decided to really get to read a lot about autism. I remember the first time I read about stem cell. I was like, wow, this is really good.
We had a lot of questions which we asked, and we got very clear answers from Dr. Sharma.
The day of the stem cell itself came. Actually, I was a bit anxious, of course, but really I didn't have fear. A bit of apprehension, anxiety, of course, as a mother, but I knew they're in good hands.
We put a needle in this pelvic bone, and then we take out the bone marrow, which is the fluid inside the bone. The pure stem cells, once they are ready, a thin needle is inserted into the lower back. We inject the stem cells into the cerebrospinal fluid. It flows all the way up to the brain.
Things that would have taken probably years to be accomplished in my sons.
They used to defecate on their clothes, but now they can use the toilet. We've seen a lot of improvement in terms of spitting. The tantrums have reduced. Sleeping used to be a problem before, but at the moment, he's taken to his bed, it takes a few minutes and he's asleep.
You see my son's cycle. You try to make them understand what it is to pedal, and they couldn't. But after stem cell, when we arrived in Kenya the following day, and we went out, and these guys could cycle. I'm going to send you to buy tomato paste, okay? I'm going to send you to buy what? In the shop. Where is the shop?
Yeah.
Okay. So I'm going to give you
Mine.
for what?
That's right.
Parents ask me, so do you really think stem cell works? And I'm like, I can see changes. I can touch. I can feel. I can smell. Of course, for me, stem cell works. I'll do it until my children get well.
And we'll just see one more. This is a child from Asia. The reason I'm showing you is this is a child who was special needs himself, did not have speech, was in a special school, who's improved so much that he's passed his 10th standard in school. But more important, today this child teaches special needs children. A child who needed help at one time. You know, I didn't believe it when the mother called me and said that, you know, he's taking tuitions for deaf children. I said that's not possible. So we had to actually go to the house to believe that a child who could not speak one day is today taking tuitions, teaching special needs children. And that's this amazing story.
Shantanu was my first child, so I was very excited about how he would be. But when I came to know that my child has a problem, it shocked me and I wondered why did this happen only to me.
Shantanu's behavior was very different from that of other normal children. For example, normal children walk on their feet, but Shantanu walked on his toes.
It has been 2 months since Shantanu's stem cell therapy. There have been many changes and many improvements. His hyperactivity has reduced drastically, and his attention span has improved a lot. He sits patiently in one place. He has started coordinating with his sister very well. He plays with her very affectionately. We are glad we took the decision to give him stem cell therapy. It has been 6 months since the stem cell therapy. Shantanu has shown a lot of improvements. His hyperactivity is almost as good as non-existent. His handwriting has become much better. His eye contact has also become better. I have never seen Shantanu dancing, but now he takes a keen interest in dancing. He also likes to listen to music. He can now fold clothes. Earlier he was not able to fold even a handkerchief, but now he can easily fold blankets. He helps me in cutting vegetable and in cooking too. Goes to the market store for purchases. He passed his 10th grade. There have been improvements in many other aspects as well. For example, this emotional quotient has also increased. Now he hugs us very affectionately, calls me mother. Now he takes tuitions of other special kids.
For other special, for deaf children. So that's, you know, you can imagine a child whose mother is not talking. I mean, whose a mother or father whose child is not talking would ever believe that one day that child would teach other similar children, and that is what has happened. Alright, so with that we finish with autism. We will look at cerebral palsy. And cerebral palsy, there is also a damage to the brain, but the effect is seen more in the body. There is weakness in the arms and legs, there is inability to walk, use the hands, and there is tightness. So in autism the problem is more in higher functions, speech and behavior. In cerebral palsy it's more in the body. There are different types of cerebral palsy. You can have cerebral palsy where one side of the body is affected, where just the lower limbs are affected, all four are affected. Then there is a dystonic type. This all depends on what type of damage there is in the brain. And this is a scan that shows you the type of damage in the brain. And there are various medical managements. There are some drugs that can help in reducing the spasticity. There are drugs for convulsions, epilepsy. There are some orthopedic and neurosurgical procedures, but all of these treat care of the periphery of the problem. They don't fix the damage in the brain. So this is our data from stem cell therapy in autism. 20%. In autism it was 33% who became normal. In cerebral palsy it is 20%. Moderate improvement is more, 41% have a moderate improvement. 30% have a mild improvement and 9% don't improve. Now in cerebral palsy, there is no connection with age. The improvement depends on the severity. The more severe the child, the less are the improvements. The less severe the child, more are the improvements. And this is a scan. On the left you can see the blue, that is the damage in cerebral palsy. If you remember autism, the damage was a little lesser than cerebral palsy. So here you can see before and afterwards, after stem cell, you can see the blue is almost completely gone. Here again, above is before, you can see both sides are damaged very extensively. And after the stem cells, the damage is reduced quite a bit. Again, all this work is published in this very important landmark paper, which is a clinical study of autologous bone marrow mononuclear cells for cerebral palsy. We call it a new frontier. But this was not the world's first paper. Some people had published before us. In autism, it is the first paper. In cerebral palsy, it wasn't the first. We have 50 more papers on that. And now to just show you a video of a child from Nairobi, Kenya, who was completely wheelchair bound, could not use his hands, could not use his legs. And you can see the amazing improvements in the child who is now off a wheelchair, is walking, and has got an independent life. Here's this child from Nairobi. Spastic quadriplegic CP. He could not sit, stand, walk independently, was totally wheelchair bound. And now you can see, he's sitting by himself, he can remove his shirt, he can put on his shirt, he's able to pack a bag, he's even improved in fine. Earlier he could not do anything, now he's standing and opening a fridge, taking out a bottle of water. This means so much to the mother that the child who was wheelchair bound can actually today stand up, open the fridge and take out water. Look at this, he's walking now. This is an older video, he's much more improved after that. Now you don't even need his support. So again, a totally wheelchair bound child is now able to walk independently because of after stem cells. Now intellectual disability, so this is, earlier this was referred to as mental retardation. Now we don't use that word anymore, we call it intellectual disability. Here the problem is mainly with higher or cognitive functions. You can see the damage here, it's much less than that of cerebral palsy. It's more widespread but less severe. And this is our data, we have an 84% success rate, 20% significant become normal, 25 moderate, 39 mild, and 13% do not improve. So the incidence of patients who do not improve is a little more in intellectual disability as compared to autism and cerebral palsy. And everything improves, their memory, their understanding of relationship, toilet, social inhibition, all of this improves. And again, the world's first scientific paper on stem cell therapy in intellectual disability is published by us. So the world's first paper of stem cell therapy in autism and the world's first paper of stem cell therapy in intellectual disability is published from our institute. And here to show you the objective, now look above is the scan which shows the damage before, and below you can see the damage is gone after stem cells. So this is objective proof that the damage of all new pediatric neurological disorders, autism, cerebral palsy, intellectual disability, can be repaired. And we have 5 papers in total. Now we come to muscular dystrophy. I understand that there aren't parents of muscular dystrophy children in the auditorium, but Mauritius does have a certain amount of muscular dystrophy. In fact, there is an association, there's a muscular dystrophy association of Mauritius. In muscular dystrophy, what happens is the muscles are normal muscles, are healthy muscles, the muscles start becoming weaker. And in a particular type of muscular dystrophy called Duchenne muscular dystrophy, all the children, 100% of them, every one of them dies in their early 20s. They die, right? It's 100% mortality. There is no treatment for this, there is no drug, there is nothing. But we have treated a couple of thousand patients and we've been able to save their lives. Our children are now living into their 30s. There is no reason for children of muscular dystrophy to die now. It's such a pity, it's such a tragedy that children are dying when cells from their own body can save them. We are not even looking at a drug outside, cells from their own body. can keep them walking. We have children of Duchenne muscular dystrophy who are walking at 16 and 18 years, which doesn't happen, right? So stem cell therapy has a very, very important role to play, particularly in Duchenne muscular dystrophy. So this slide shows you, now you see at 5 years, you can see the scan. This is normal muscle. You know the black and grey, this is normal muscle. And you see over the years, 6-7 years, you'll see the black is going and it's more white. White is fat. And by 16 to 20 years, there's no muscle at all, it's only fat. So this is how it progresses. These children, first they have falls, gradually they have difficulty in standing, then they have difficulty in getting up from the floor, slowly they become wheelchair bound, then they become bedridden, and finally as their heart stops functioning, as their breathing becomes difficult, they can't sustain life anymore. So you can see here again at 5 years, that is the damage, that is the normal, this is a normal MRI. And at 20 years, you can see there's almost no muscle. Okay. Now this is another thing which is showing us the muscle activity. You can see muscle activity is there, and here there's almost no muscle activity. So this is all data from MRI scans, and so this is data from 1,500 children who we've treated. 4.5% have had a significant improvement, 35% have had a moderate improvement, 20% are mild, and 14% are stable. Now you have to remember, if not treated, all these children would die. So you have to compare this data to the fact that there's 100% mortality and we are able to save their life. We have children who've crossed 30, which otherwise just does not occur anywhere in the world. So it's very important that families of muscular dystrophy children should be given that hope. They should be told that using cells from your child's own body, we can save their life, we can stop their deterioration. And this is a comparison. So this is called a Kaplan-Meier curve. So the above one shows children who were treated with stem cells, Duchenne muscular dystrophy patients, how they stabilize. And we compared it to children who did not take the treatment, and you can see the deterioration. Okay. So this is the deterioration which would occur in children who have not taken stem cells, and this is children who have taken stem cells. There is such a big difference between the two. And this is objective proof. This is an MRI scan where you can see the white above is fat, there is no muscle, and after stem cells you can actually see that the muscles are coming back. You can actually see that muscle regeneration. So the MRI is showing muscle regeneration after stem cells. This is something called an EMG study where you can see the muscle contractions. They are very, very weak before and after stem cells. You can see that the muscle contraction have become stronger and are more. And we have 18 scientific articles on stem cell therapy in muscular dystrophy. So here's this child with Duchenne muscular dystrophy. He's from California, United States. And when he came to us, he could barely crawl, right? He had not stood for 2 years before coming to us. This is how he was before, unable to stand. And then you can see the amazing improvements after stem cells. You know, you can see that he's able to stand now. And, you know, for somebody else it may be a very small thing, but for the parents it's huge. A child who's not stood up for 2 years, when he starts standing, it's big. When he starts taking baby steps like this, that's even bigger. And there you can see he's walking on parallel bars. And now you can see that he's able to walk without any support. This is indoors. And there you see that he's able to walk outside. And in fact, his success story was heard by the President of the United States, President Obama, who invited him to the White House to meet him. That's him with the President of the United States. Because the President of the United States, President Obama, was very much interested in stem cells as well. So he had a unique privilege to meet the President of the United States. Since there aren't adult people, I'll just run through very briefly. Stem cell therapy also works in spinal cord injury, where the spine is fractured and people cannot walk. It's called paraplegia. Sometimes the hands and legs are not working. It's called quadriplegia. And in over 1,000 patients, we have a 96% success rate, with 24% of the patients doing very well and just 3% not improving. All their symptoms improve, from tightness of their limbs to sensations to better trunk control and finally to walking. Our work is published again. This is a paper on thoracolumbar spine injury, and we have 9 other papers on spinal cord injury. Here's this video. This was a captain from the Indian Army. He was shot by terrorists, and he was totally paraplegic. He could not move his hands. He could not even stand. And you can see after stem cell, he started sitting. He started transferring. And when he came to us, he asked me, you know what he told me when I asked him what he expected? He said, "Doc, make me good enough so I can get a gun in my hand and go back and kill more terrorists." And we kept our promise, he improved so much that now you can see he's walking. He won a bronze medal in one of our pre-national championships. He won the highest bravery award in peacetime, Shaurya Chakra he was awarded, and he won a bronze medal, and he's actually joined back service in the army. Okay, so that is the extent of improvements, that a person was totally paralyzed, is now walking. He won a shooting championship, and he joined back active service in the Indian Army. A brain stroke, we all are aware there is a stroke. It's a vascular event which results in paralysis of one side, hand and leg. And this is our data from stroke patients. 51% show a very significant improvement. So here we have got very high results. The paralysis on one side, it was earlier believed once you're paralyzed in brain stroke, nothing can be done. But they get their hand function back, they get their leg function back, they get their speech back. And this is a scan that shows before. You can see the blue is the damage before, and afterwards you can see there is a big reduction. That's the speech area, you can see it's damaged, and here you can see that it is resolved. And we have 6 scientific papers in stroke. Head injury, we have a lot of road traffic accidents, and because of that, people go into coma, they go to a vegetative state, and this is our data, 29% who improved significantly, 5% did not improve. Here you can see the damage before, and you can see afterwards the damage is resolved. Again, all this work is published in scientific journals. Cell therapy in traumatic brain injury. These are other papers. And you see this patient before how he was almost vegetative. He could not understand. He was like almost, totally vegetative. And you can see now, after stem cell, see on the right side, he started responding. Earlier there was no response. He started responding, he started understanding, he started using his hands and legs. He had one side of the body which was totally non-functional, that improved. He was able to sit, which was earlier not possible. So it's like life came back. You can see he was earlier, right side was not moving at all. Now you can see the right side, he's able to use that hand. He's able to feed himself. For the first time after stem cells, he fed himself. For the mother, it was such an emotional moment that he could actually take a biscuit. It's something small to others. But I remember the mother broke down. The very fact that he took a biscuit and put it in his mouth. He's able to show body parts. This is a vegetative child who's actually recovered so much. And now you can see he's actually operating a mobile. Okay, somebody who was totally non-responsive is operating a mobile. And now he's able to actually stand up, maybe with assistance, and he's able to walk. Okay? So this is the power of stem cells. And the last condition I'm going to talk about is motor neuron disease. This is a disease which, the famous scientist Stephen Hawking, he had this. In this, normally 90% of the people die within 5 years, and this is a comparative study with it. Patients who receive stem cells, they stabilize like this, and those who didn't, they continue to deteriorate. We've published this paper where we've done a control study, where we've actually shown data of treated patients as compared to untreated patients. And there's a big difference. This is all the papers that we have published. This is Dr. Himangi.
I was practicing as a consultant in New York when I developed motor neuron disorder. I started deteriorating neurological, and so I consulted the best doctors in America, including Sion Hospital, who told me there was no hope and this was a fatal disease. Then I came to India and approached Dr. cells 10 years ago. After cellular therapy, there has been halting of disease progression and improvement in speed, swallowing, and stamina. I have improved significantly and now working as head of research at NeuroGen Brain and Spine Institute. It is my request to all my medical friends and colleagues to please consider stem cell as a treatment option for incurable neurological disorders. I am a living example of the potential and power of stem cell therapy.
So this is Dr. Himangi Sane. She was a doctor in America. She got her MD from America. She was working in New York. She developed an illness which was fatal. In America, everybody believes the best treatment in the world is in America, right? Don't you believe that? Okay. She was a doctor in America. She went to the best doctors, including Johns Hopkins. They all told her you have a few more months to live. That nothing can be done for you. She didn't give up. She came to India. She came to me. That was over 10 years ago. And today, she's improved so much that she's now working as the head of our research. She works with us. She takes rounds of the patients. All our publication work is looked after by her. So she is a living example of the fact that what could not be accomplished in America was actually accomplished in India. Had she stayed back in America, she would not have been here amongst us. Okay. But she came, she took the treatment, and she's better. So one question which all of you must be concerned with is, okay, the results are good, but how safe is the treatment? Because as parents, what is the first question in your mind? Not efficacy. What is the first question? Is it safe? Are there any risks? So here's the good news. In the 12,000 patients we've treated, we've had no major adverse events or complications, no neurological deterioration. Means no patient of ours has worsened as compared to before the treatment. So what is the major complication? It is something which is irreversible, or it is a deterioration as compared to what the child or the patient was before. So we've had no irreversible, no deterioration. However, there are some minor adverse events, the most significant of which is epilepsy. So in children who have a history of epilepsy, whose EEG is abnormal, in 3% of those, there can be an increase in the incidence of seizures. This is something that we have published as a separate scientific paper, that there is a small incidence of increase in epilepsy, but in those kids who already have epilepsy, 10% of our children immediately after the stem cells will get a headache, maybe a vomiting, which lasts for 2 days. It's called a spinal headache. The headache goes away on lying down. It only comes on sitting. So, but this happens when you're in the hospital with us. It does not happen when you come back home. And a few other patients, children may have some pain at the site, but this is temporary. It responds to treatments. So the good news is there is no major side effect. And I'm saying that's a different thing. If we just look at the nature of the treatment, only 2 needle pricks. How much harm can a needle prick do? And what are we putting in the child? The child's own cells. How much harm can our own cells do to us? So that's why this is safe. The very nature of the treatment is safe. Now we come to the last part of our treatment. I spoke about cellular therapy. I spoke about rehabilitation. Now I'll talk about what are called integrative therapies. So these are, integrative therapies are different from drugs. This is some other therapies that we do. So these are all, we use machines and modalities. The most important of which is something called hyperbaric oxygen therapy. Most of you know it as HBOT. I'm sure you've heard about this. So what is hyperbaric oxygen? Right now we are breathing oxygen at 1 atmosphere pressure. At 1 atmosphere pressure, the oxygen when it goes into our blood and it gets carried in the red blood cells of our blood. Our blood has got red blood cells, white blood cells, platelets and a liquid called plasma. I'll repeat, red cells, white cells, platelets and a liquid called plasma. Right now, the oxygen that we are breathing is carried in the whole body only in the red blood cells. But when you go into this machine, that is a hyperbaric oxygen machine where the pressure is given at 2 atmospheric pressure, the oxygen gets carried in the liquid of the blood. The whole plasma, the whole blood is full of oxygen. And that means oxygen goes to every little part of you, right? So, we actually started using hyperbaric oxygen for severe neurological injury. We then started using it as part of an anti-aging program of ours. And then now it's got integrated into treatment of autism, cerebral palsy as well. And we are finding that combining these treatments with cell therapy gives us the best possible results. So this is a hyperbaric chamber, and here you can see it's a machine that you go in with your child. You just lie down, it's very comfortable. There's a TV screen up there, and we normally put on cartoons for the kids, so the kids are very happy. The kids enjoy this so much that they don't want to come out. It's sometimes difficult to get the kids out of it because they enjoy it so much. They're in this cozy place, they're cuddled up with their dad or mom, and they're watching TV. So it's like a fun thing. So that's what I said. The oxygen gets carried through the whole blood. And it has a lot of beneficial effects, including repair of damage, including promoting what is called neuroplasticity. You know, where the cells make new connections. Not only do the damaged cells heal, but new connections are formed. It releases certain positive chemicals in the body, like serotonin. So there's a lot of study. This is just technical data to show its benefits in autism and cerebral palsy. So that was hyperbaric oxygen. That's a machine you go into. Each session lasts about an hour. Then there is something called ozone therapy. So oxygen is O2. Ozone is O3. It's a more activated, it's a super activated form of oxygen. It is given in different ways. Basically, it kills any virus, bacteria, fungal, reduces swelling, reduces blood clots, and has an antioxidant effect. So it's very powerful healing effects overall. And this is the various action of it. Now it is given either you have to sit in a chamber and the ozone is given. You can breathe it. It is given through the ear. It is given through the rectum. There are different ways of giving ozone therapy. So we have found that it improves oxygenation in the whole body. It also improves the gut. We know that there is a relationship between the gut and autism. So it has a gut cleansing effect and what is called an anticoagulant effect. So there are a whole lot of benefits of ozone therapy in both autism and cerebral palsy. Then we use something called acupressure or deep tissue mobilization, which also has several beneficial effects. And then we use supplementation. So these are the various minerals and vitamins. If they are deficient, we replace them. So the minerals include magnesium, calcium, zinc, selenium. The vitamins are the entire list that you can see, all of them. So these are various things that we identify what's missing in the child and then we supplement it. Of late, we are finding a very important relationship between vitamin D and autism. We are finding almost every child that comes to us has low levels of vitamin D. And the reason is vitamin D is manufactured. Do you know how vitamin D is manufactured in the body? By the sun. Okay. Naturally, vitamin D is made in the body when you are exposed to the sun. But unfortunately, in today's life, we are always indoors. We are in cars and homes, everything is air conditioned. It's lack of exposure because vitamin D is manufactured. And there are a lot of studies that show the connection of autism to vitamin D deficiency. So we replace all of that. So these are all the benefits you can see. We have seen. So this is adjuvant. I'm not saying it's a separate cure. When we combine all these treatments, we get the best results. Like I said, from decreased hyperactivity, behavior, sleep, repetitive behavior, improved learning, better eye contact, better cognition. All these are treatments. All these are effects that we see. So this is just again a list of all the improvements that we see in cerebral palsy. So this is our institute, the NeuroGen Brain and Spine Institute. It's situated in Navi Mumbai, India. This is an institute that has been set up specifically to treat incurable neurological conditions in children, autism, cerebral palsy, intellectual disability, muscular dystrophy in adults, any form of paralysis because of stroke, spinal cord injury, motor neuron disease. So it's not a general hospital, it's a hospital that has been set up for this purpose only. So everything in the hospital is structured around what I have described to you. We have treated over 12,000 patients from 70 different countries, from all the 6 continents of the planet. This is our core team. Apart from myself, Dr. Nandini and Dr. Prerna are our stem cell experts. Dr. Jacob is India's senior most neuro-rehabilitation specialist, and he's over 80 years old, but he monitors the entire rehab. We are very blessed to have him with us. And you know, this whole team, we've been working together for the last 20 years or so. And Dr. Himangi, you just heard, she's a medical physician who herself has taken stem cells. We believe a lot in quality control, so we have a lot of accreditations. We are good laboratory practice, we are ISO certified, and we have a good manufacturing practice. So these licenses, these accreditations you get based on quality. We also have a accreditation from the European Medical Association. So you can see the European Medical Association has given us as a reliable healthcare provider and best medical practice. So, you know, and this is important, a best medical practice certification from the European Medical Association. We have published 18 books and we have received numerous awards like this one, the Bharat Gaurav Award, which is given in the British Parliament for exemplary work. This is the 2021 Superhero Autism Award. This is the Rose of Paracelsus Award. It's a very honored recognition which you get from the Socrates Nomination Committee of Oxford, UK, and this is given for innovative research work. Then the European Society for Quality Research, they actually give us the award for best practices once again. This is again for pioneering and innovative research. We were nominated the Best Stem Cell Therapy Center in India at the National Healthcare Awards in 2016, again in 2018, which was given by the Minister of Health to us. To help you make your decision, we have a website. Please visit that, www.NeuroGen BSI stands for Brain and Spine Institute.com. You can email us. You normally will get a response within 30 minutes by a doctor. Our email responses are not from administrative people, but by a doctor. You can WhatsApp, audio, video call, or you can set up a video consultation, which is all offered without any cost. So if any of you want to consult with any of us personally, we can do it through a video consultation with a prior set appointment. Once you've decided to take the therapy, we appoint a coordinator who becomes your one point of contact. So to minimize your trouble, you don't deal with 5 people, you deal with one person only who will help you with all your arrangements till you get to us. And once you get to us, we pick you up at the airport, we take you to a hospital and we drop you back to the airport and we look after everything in between. So all you have to do is just land at Mumbai airport and we will take care of everything. So you arrive on a Sunday, we have Monday is the day of evaluations, Tuesday is stem cell therapy, Wednesday to Saturday we have rehab, and on Saturday we discharge the patient. This is a 1-week program. We now have a 2-week program where we include all the integrative therapies as well. So you have an option of a 1-week or a 2-week program. So in conclusion, stem cell therapy, the type that we do, which is adult stem cell therapy, is a safe and an effective treatment option. Remember, I'm putting safe before effective. That's to highlight the importance of safety. It's a safe and effective treatment option for autism, cerebral palsy, and for many other neurological conditions in children and adults. I spoke to you about all of them, for which there were no other treatments, but which now can be treated. We saw the Honorable Prime Minister of India talk about stem cells in the Indian Parliament. The 2 biggest democracies in the world are India and America. Now let's listen to what the President of the United States has to say about stem cells.
Scientists believe these tiny cells may have the potential to help us understand and possibly cure some of our most devastating diseases and conditions, to regenerate the severed spinal cord and lift someone from a wheelchair, to spur insulin production and spare a child from a lifetime of needles, to treat Parkinson's, cancer, heart disease, and others that affect millions of Americans and the people who love them. Today, with the executive order I am about to sign, we will bring the change that so many scientists and researchers doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research. There's no finish line in the work of science. The race is always with us. The urgent work of giving substance to hope and answering those many bedside prayers, of seeking a day when words like terminal and incurable are potentially retired from our vocabulary.
So I show these two videos to show you that when the Prime Minister of India and the President of the United States are talking about a medical treatment, have you heard of them talking about any other medical treatment? Okay, there must be something to it, because presidents and prime ministers don't talk about a subject lightly, right? And I like this particular thing that President Obama said. You know, he said, giving substance to hope. You know, one thing is to hope, and we all can hope, and the other is giving substance. Stem cells are that substance. Integrative therapy is that substance which we can actually give our children and help them reverse their disabilities. And think of answering those many bedside prayers. I'm sure all of you have prayed so often. And I think that's all that is there. When a parent has a child with special needs, your prayers are about one thing and one thing only: for your children to get better. Okay, and so he talks about stem cells answering those prayers. And the last part that he says, of waiting for a day when words like terminal and incurable are finally retired from our vocabulary, right? So stem cells gives us that hope of retiring these words incurable from our vocabulary. So this is the new hope, and I come to you with a message of hope. I come to you on a special day, Mauritius Mother's Day, and I want you to know that whatever we are doing, there is only one single intention in our mind, that our special needs children somehow get to become independent, that they are not dependent on anybody. Because I'm sure as you look after your child, your biggest worry is, we will look after our child as long as we are there. What about our child after us? Okay, but with stem cell therapy, in your lifetime, in the next couple of months or years, you would actually have the possibility of seeing your child get back independent function, as I showed you in the videos and as our data and scientific papers show us. So I want to thank you for your attention. Thank you for listening to me patiently. I hope that I was able to pass on that message of hope to all of you.